moist enough, dryness of the skin. We usually check it with the back of our hand, right? Because the front of our hand may also be kind of wet, so we're not going to be checking it correctly. So back of the hand to back of the hand. Is the skin normal? If you feel it rough, like coarse, fine sandpaper, maybe fine sandpaper, then it's dry. If it's smooth, it's normal. Also, as you're doing this, you're checking temperature of the skin, and usually take 2 hands so you know it's symmetrical.
Yes.
Wetness symmetrical, dryness symmetrical, temperature symmetrical. Are the palms cold, or are they hot, or are they normal temperature? Okay?
Elastic.
Right? If they're very cold, but he's hot, but the palms are cold, check the feet. Maybe the feet are also cold. If the feet are cold, then we have an imbalance in the thermal regulation, which could be that he's running a fever, or it could be some other reasons, hormones of the thyroid gland, for instance, right? Or the hypothalamus. After we do that, we can check for elasticity on the skin. The skin should be elastic. As you make a pinch, you let go, it should disappear immediately. Also, you can check it here. Same thing, pinch, let go immediately. If it doesn't disappear immediately, this may be a sign of dehydration. This may be also a sign of loss of elasticity of tissue due to other reasons. Dermatomyositis, sclerodermite, possibly, but usually dehydration. And also, if you make a pinch and let go and it takes more than 2 seconds to disappear, this is a sign of severe dehydration. Such dehydration that he needs to get IV rehydration for it. Right? Maybe other reasons for the skin fold to disappear slowly, but usually with children, in 99% of the cases, it's dehydration. The 1% is other reasons. So we can always assume that there may be a problem with dehydration and check that first, because that's the most dangerous thing, if the child is dehydrated. The rest, sclerodermitis, well, we'll figure it out. Like, we'll treat it eventually. It's not dangerous right now, at this second. Okay, so we checked for elasticity, the pinch, dryness, wetness,
Temperature.
and temperature. Also, we're at the same time as we're taking the hands, we're also looking over the entire skin, and we're looking for skin color, discolorations, everything that we've mentioned. Erythema, jaundice, paleness, blue, cyanosis, acrocyanosis around the nose, lips, fingers,
Yes.
right? Also, as we take the hands, we're checking the wetness, we're also looking at fingernails. Now, what are we looking for? Now, if they're increased in thickness, the glass fingernails, right? This is a sign of hypoxia. Or the fingers are extended in the horizontal. This is drum fingers, also a sign of hypoxia. Also, we're noting, are the fingers cut or are they bitten? If the child is always biting fingernails, this may be a sign of stress or neurosis. Okay, so we're checking for multiple things. On the fingernail themselves, are we checking to see if there are white lines on the finger? If there's a lot of white lines, this may be a sign of vitamin deficiency, or maybe usually microelement deficiency such as magnesium. Right? White lines may be a sign of magnesium deficiency, or maybe other vitamin deficiencies. So the child should be checked. Also, biting fingernails, if the child is stressed, nervous all the time, what he should also be examined for is helminthosis. Right? For helminthosis. And why helminthosis? Well, for one reason, if he's biting his fingernails, right, everything that is under the fingernails gets inside his mouth.
Yes.
And what accumulates there is usually eggs of helminths, whether he's playing in the ground, in the sandbox, or maybe he's scratching himself. Right? And he's getting outer reinfection. And the actual agitated state could be due to helminthosis. Children with helminthosis are more prone to being angry, agitated, because especially if it's certain forms of helminthitis, they may be having poor sleep at night, right? They sleep poorly at night. They're agitated, can't sleep, so they're agitated during the day. Why can't they sleep at night? Because the helminths come out of the anus during the night, and they start irritating the skin. The child scratches himself, he doesn't even know, and then he bites his fingernails. Okay, so checking fingernails is also very important. Okay, what else are we checking for? When you do the pinch test, we can check for elasticity, but we can also check for the thickness of the underskin fat layer. Right? The underskin fat layer should be checked here, here, under the scapula, here. Could also be checked, not here, usually here, right here. Now here it would be the thinnest, the largest should be about here, but they should still be mostly symmetrical. If it's very large here and really thin everywhere else, then it's a type of sort of a hormonal type of obesity, a type of hormonal obesity that causes obesity specifically around the abdominal area and nowhere else. Okay, what else are we checking for? The pinch test. You can do it either here or here or here on the shoulder. The pinch test is done this way. You take the skin with 2 hands and start going like this. It may hurt a little bit. We're causing damage to skin. This will result in petechias. If the skin resistance is normal, if the thrombocytes are okay, right? If the blood vessels are okay, they're not prone to hemorrhages, you should see with the next 2, 3, up to 5 minutes, no more than 5 petechias. Little tiny hemorrhages. For this you might need to use a lens. Or if you can see it all right yourself, look at it for yourself. No more than 5. If we get many more petechias, means the blood vessels are prone to damage or there's a problem with thrombocytes. Okay, it's called the pinch test. You should need to know this for practical skills. What else? We can check for turgor of the skin. Or actually not of the skin, but of tissues. Now if the child is dehydrated or if he's losing weight, maybe we can open the doors and keep them open, both of them. Open both of the doors and keep them open, please. The turgor of the skin or of the tissue is usually checked on the leg, like this. Now what we're checking for is that the muscles, the skin, the underskin fat layer, it's all elastic and resistant. It should be fairly resistant, right? You take your leg and check it, you should feel that the muscles are kind of dense. Not hard, but resistant, elastic, right? If they're soft, like dough, bread dough, if they're soft like that, means that the turgor is lowered. There's a problem with tissue turgor, okay? And finally, when we look at the skin, we're looking for rash elements. Turn around. Rash elements. So any kind of rash elements on the skin. For instance, hyperpigmentations. We see, if there's just a few, it's usually birthmarks, okay? They're usually okay. If there's many, then it's a different question, right? Then there's a papulas, maybe pustulas. What's the difference between a papule and a pustule?
Pustulas contain the purulent?
Yes. Pustula has a cavity and it contains pus. So leukocytes and bacteria. A papula does not. It's a non-cavity rash element. Primary inflammatory rash element. No cavity. Okay, so we're looking for all rash elements. Erythemas, etc. Then we can check for dermatographism. Take our fingernail and move it like this on the stomach. It should change color to red.
Yes.
See the line?
Yes.
In some cases it's slightly red, in some cases it's more red. Okay? In some cases it's the first, when you make the line, it should turn white. After a few seconds, turning red and then disappearing. If it stays white, see the line? That's normal dermographism. If it stays white for prolonged time, means we have a tendency for vascular spasm. Tendency, therefore, for higher blood pressure and etc. If it's red and it starts going like this, red, 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 and the abdomen turns red, it's the opposite. We have a tendency for dilation of blood vessels and therefore tendency for lower blood pressure. So from the skin, we can make a lot of different conclusions. A lot of different. When we examine the skin, we examine the fingernails. We also examine the hair. We're looking at the hair that there are, it's not falling out. We don't have alopecia, right, falling out of the hair. We don't have white spots in the hair, right, white clusters of hair. Also, we're looking for rash elements on the head. For instance, rubeola, which is also called measles, right, is a childhood disease. The rash elements start from the top down. The very first rash elements will start on the head, under the hair. So the child may not even have on the face yet, but have on the hair. So you should always check rash elements on the hair first. That's where they're going to start. So you might have came in really early because his temperature rose. You looked at him, no rash elements. Oh, well, it's the flu, and you left. right? But a couple of hours after you left, he started having rash elements on his face
Yes.
because you missed the ones on the head. Okay, so you got to examine everything. What else? The sclera of the eyes, the whites of the eyes. Peel it down, look at it.
Yeah.
If it's yellowish, we can call this subicterous. If the entire skin is normal, but the whites of the eyes are yellowish, this is subicterous, means the bilirubin is risen, but not high enough to cause jaundice. Just slightly risen. Also, we can have blue sclera. This is a typical sign of iron deficiency anemia. Blue sclera, typical sign of iron deficiency anemia. Scleras can also have lots of blood vessels visible, which is usually means there's a stress on the eyes, right? Some kind of stress on the eyes. What the child was doing, we're not sure. Maybe something got into the eyes, right? Something dirty. Maybe he was touching the eyes all the time. Maybe he was watching, I don't know, TV for the past 24 hours straight. Who knows, right? Blood vessels in the eyes. Maybe dryness of the eyes. If the eye hurts, the child keeps touching it. You can see a dry spot. If you can't see it, then you need to use a tool from otolaryngologist tool. But you will see that the sclera is dry. There's a symptom called dry eyes, right? It's treatable as well. Also, usually due to stress, overexertion of the eyes, not enough tear fluid covering the eyes. So the eyes are always open, not blinking enough. Okay? So we're examining that. Well, after that, usually when we do examination, it's best to move on to examining lymph node, but we haven't gotten to that topic yet, and moving on to examining the oral cavity. Now, the oral cavity is examined for two reasons. One, the gastrointestinal tract, and two, respiratory tract. Right? We will look at the oral cavity right now from the terms of the respiratory tract. Okay?
Yes.
Oral cavity in terms of respiratory tract. Now, what we use for the examination of the oral cavity is usually a laryngeal spoon, which is like a stick, right? Any kind of a stick. You can buy them anywhere. There's wooden ones, plastic ones, whatever, right? Metallic ones even. And you will probably need a flashlight. Hold on for a second, I'll just get a flashlight. I think we don't need a spoon.